Today we're going to talk about adult learning and how adults learn differently than children, and how when you're teaching and communicating with adult learners, it works a little differently than what you might think. However, we're also talking about college students here, and so you have to take the age of the college student into consideration, because it's not a light switch flip where people are, in 11th and 12th grade childlike learners, and then magically they get into college and they figured out how to be an adult learner. It's a progression, and so we're going to talk a little bit about that. So today's discussion does also have continuing education with it, and for participating through the whole event and then sending me the certificate like you did last week, you'll have 0.5 contact hours awarded for it. And so, as I just said, adults learn a little bit differently, and it's a gradual change as they mature. So we have a little bit of information here on some of the different elements of learning. I didn't go into all of them because we're talking about a clinical setting and a preceptor relationship. And so some of the phrases that help are, when you're teaching a child, you lead the child. You tell the child where the child's going in learning. And when you're teaching an adult, you help the adult figure out where they're going, what they need to learn to get there. And this is really based on Noel's work, and his work was started in the 50s and ended in the 90s. So not super old of a model, but definitely one that's been tried and true. So a lot of what we're going to talk about today, Tanya, you've done patient education, you do it every day in your life, and you're going to recognize some of these aspects from patient education. So I don't even really need to go through everything that's on the slide. I gave you a little more information here in the PowerPoint than what we have to talk about. But some of the aspects that we want you to remember whenever you're dealing with that adult patient or the adult learner in a professional way would be the role of their previous experience. So all adults have life behind them in some way, shape, or form. And this is why a child doesn't have as much experience. As they mature, they gain experience. And so if you've got a 22 or a 23-year-old college student beside you in the clinical setting, they're in that maturation process. And if you've got a returning second career person who's in their early 40s, the amount of experience that person has already in life, maybe not in nursing, but in life, is very, very different. And so that's what you take into consideration when you're working with an adult. And that experience is very important to them. So teaching to it and incorporating it is very beneficial. And then readiness to learn. Not all learners are ready to learn, and that's a real important aspect with patient education, as you know, and it works the same way with clinical education. So keeping the focus on the learning life-centered or a developmental step. What are they doing in life right now? Well, your folks that you're working with are in college, and so that's really what this learning needs to be about, is what they've chosen to go into in college, and that's a life-centered event. And then how are they looking at learning? So again, a child is very subject focused. They learn what they're told. Now it's time to get out our math books, right? So they're told what to learn and when. Adults, on the other hand, aren't going to learn until there's a problem or that task that needs to be learned. So if I'm having a dinner party and I don't know how to make a roux, I'm going to be very task focused, and I'm going to go out and seek the resources and figure out how to make the roux for my dinner. So that's a task focused. And so sometimes when you're dealing with those college students, it's very task focused. What is it that they're supposed to be learning this week? And they're focused on that task. And sometimes that you have to teach to that so that they can get past that point. They stay very focused on the task that they need to learn, because it's a life developmental task focused learning. And then the motivation to learn. Again, children learn because the teacher or the parents, they want them to be happy. Adults, it's internal. It's that quality of life or self-esteem that they're going with. So boiling all that down to plain English, adults learn better when they understand why something's important to know, when they have the freedom to make choices in their learning, when their learning is experiential. That's really important. We're going to talk about that in a minute. When the time is right for them to learn. They're not going to learn ahead of time because it's problem-based if it's not a problem for them. When did you learn how to change a tire? I had a father and a brother who made sure I knew how to change a tire before I left home for college. Guess what? I didn't know how to change a tire. I didn't learn how to change a tire until I had my first flat tire. And that's when I really figured out how to change a tire. And that's what it means by the time is right. You figure it out at the time. You may have some base knowledge, but you really learn it when you need it. And then obviously, as in every learner, a positive and encouraging process. So as a preceptor, it's real important that you are able to assess their learning needs. And this isn't a full educational assessment. We're just really wanting to make sure that preceptors are taking a moment and figuring out what this student needs to learn. Where are they in life? Where are they in their curriculum? Where are they in that problem-focused learning? What is it that they want or need to learn from the experience or from that day even in particular? What do they already know about it? Where have they worked in the past, and what might they know about that specific type of task or learning already? And then you can learn a lot by just observing their confidence or their hesitancy in doing something. That'll tell you a lot about, as an adult, what they already know or don't know, or where their worry points are. We're going to talk a lot about questions. As a preceptor, we want you to encourage questions, and then we want you to listen to the type and the number of questions, because that goes back to their confidence. So we want you to ask questions. We want you to encourage their questions. So learning is experiential, as we said. Active learning, adults want to do. Adults want to make sure they can apply it. So it's all about the action and the value and the linking of whatever they're learning, whatever their brain is focused on right then. How are they going to apply it in real life? That's what they want. That's what they need. So when you are planning those experiences for that learner, I want to make sure that you're avoiding accidental learning. At least that's not a real phrase. That's kind of a phrase I use a lot. But I've had a lot of preceptors I've worked with over the years, and their strategy is, well, they follow me around, and whatever happens, they learn. And that's accidental learning. And what we need for a college student especially, or a new hire, we need it to be planned learning, so they get to learn what they need to in the time they have. So it's real important in instances like you're working with right now with college students to base their learning on the curriculum needs that they have, on their individual needs. It should be very intentional. And then you should be moving from simple concepts, move that through to complex concepts. So at the beginning of your time with the student, you start with the simple things, the easy things. Even though something complex might come up in your setting, they might not be ready to learn that. Remember, they're only going to learn what they're ready to learn. So starting with the simple concepts and moving through then to the complex concepts is the best plan when you're talking about learning. So want to spend just a minute talking about the importance of learning, and this is actually called inquiry-based learning. It's very learner-centered. It helps the learner engage in making sense and applying whatever the question is, whatever the learning topic is, really helps them apply it to life. And so rather than just giving facts, which nurses often want to do, we want to give people the information. Inquiry-based learning actually helps the learner find the solution or problem in previous learning, and that ties that experience back to what they're doing right now. So some ways to use inquiry-based learning are to understand the differences in the types of questions. You can ask who, what, where, and when questions, and in doing so, you're looking for knowledge and you're tapping into their previous knowledge bank, and that's on the simple side. We talked a minute ago about simple to complex. So when you're asking who, what, where, and when, you're on the simple side of that equation and you're looking for a base knowledge. And then you move into how or why questions. And when you ask those questions, you're encouraging the learner to kind of start using a deeper level of analysis of whatever the topic is. And then finally, the most complex would be should or would questions, because those drive an evaluation of the situation. So again, simple to complex in the use of questions. So some examples of those, some simple questions would be, did you take the vital signs? Is this a normal value for potassium? So those are very yes, no, or simple answer type questions. And then you would move forward into some more complexity with the analysis questions. What are your concerns about this patient? What information do you still need? What could you find, or where could you find that type of information? Where else might you look? And then the most complex type of question you ask would be looking for an analysis or a full evaluation. What should we do about this now? What else are we going to do? What community referrals might be helpful? You really want them to think outside of those simple yes, no, or fact questions. So Tanya, just taking a second here, have you ever used questions of inquiry as a preceptor?
You know, I don't know that I have. I have a tendency to be a more conversational approach with things. But I can see how that would definitely be a good way to move forward.
Okay. Yeah, it really does get there. When you look at theories of brain-based learning, especially with adults, there's such a knowledge bank inside the brain, but it's kind of like a big file cabinet. If we don't help learners attach one piece of information to previous to find the file in the file cabinet, so to say, sometimes they just put it in a whole new file, and then the two pieces of information never really get associated. And for some reason, questions help adults find that other related information and connect the two, so it adds to the build and gains that really usefulness of the information. It's pretty cool line of study and very, very easy to use in the clinical setting. And really a lot of that is based on Bloom's taxonomy, which probably doesn't mean a lot to you, but to educators, it's a real solid theory we use. And on the left-hand side of this table, you'll see the types of questions we just talked about. And on the right-hand side is the mental process that the learner's going through. So if I ask a do question, I'm asking them to remember. You know, do you remember this? Do you see this? I'm asking them to, again, very simple things. If I go up to why, I'm asking them to apply something. Why would you do this? How can we do this? Is analyzing. And so again, just it goes through the different levels where people are actually thinking at in that build. So one of the last things I want to show you is how important that discussion, and Tanya, I'm really, really glad that you said you're more of a discussion based, because that's what the questions are. They're in that same type of learning. But you can see the build here when we're working with students, when we're working with anybody, actually, we all learn this way. If we only read something, we're only going to retain about 10% of it. If we get all the way up to discussion with others, we are going to retain about 70% of that information. It really helps move things from short-term memory to long-term memory for discussion. And then the best way is when we have to know it to the point where we can teach others. So again, in a clinical setting, having that student actually be able to teach back you what is going on, or to teach the patients what they need to know, it really brings it all the way up to about a 90% retention rate when we have to teach somebody else. Okay, so Tanya, any other thoughts or comments on this brief content?
Well, the only thing I can add, I mean, one thing that I find helpful, and I feel in the way I learn is also good with this, is I do like to teach by offering my experiences. You know, like maybe this might be a better way of trying to do it, and this is why this happened to me, and you know, that I find that really helpful too.
So you're actually using your experiences as a case study for them. This is what happened, and this is how I found out. And case study is a great way to teach adults.
Mm-hmm. Yeah, I mean, talking at somebody and telling them do it this way, for myself, I don't learn well that way. I need that extra piece, and I don't know. Mm-hmm. I think that's really helpful.
That's a very typical adult approach to learning, Tanya. You've got it. You could apply it in your own life, and you're using it with students. So that's great.
Good.
Wonderful. Okay.
Barb, I don't know if you saw, but we have Cheryl who joined us also this morning.
Awesome. Hi, Cheryl.
Hi, good morning.
Welcome.
Good morning.
Cheryl, I don't know at what point you joined because I don't see you on my screen, but do you have anything to add from what we went through?
No, not at this time, but
Okay.
Thank you.
All right. So as you're looking at working with the upcoming students, Tanya, I know you have one. Cheryl, I don't know if you have a student with you right now, but are there types of activities within the clinic setting there that might lend itself into one of these three types of questions differently? Can you think of how, going forward, you might be able to move an activity from simple questions through complex questions?
Well, I was thinking, just as you were reading through this, I could probably get her more involved. I do make a lot of calls to patient to talk about results, and I can see how that would definitely be beneficial before I call the patient, to get her involved and try to get her to talk through it, and before we call the patient.
Perfect.
these
Yeah,
questions.
moving her up into what's the concerns for this patient.
Yeah.
Yeah. Yeah, that's very good. And helping them think out loud with you. Again, like we said last week, when you're working with a novice or an advanced beginner, you thinking out loud and then using these questions of inquiry to get them to think out loud, it really does move everything up the mental complexity level,
Mm-hmm.
which is the basis of developing critical thinking. And that's what we want in nurses, right? When we've got student nurses bias, we're all working to get them to think at the highest level they can. And that's really the basis for it. Okay. Anything else, guys? Any other questions?
None here.
All right. So then you'll be getting an email from me, and it will have an evaluation attached. And when you send me that evaluation back, I will be sending you your certificate for today. And it will come from my case email.
Okay.
Becky?
Hi, Barb. This is Mary. I'm sorry to come in late. I have one question. This was
Yeah.
really great. I'm thinking that even for my work, I'm going to make like a little tip sheet cue card that I'm going to keep with me, like when I teach students on the inquiry levels, because I think that's really like a great step up, for students learning. You talked about adult learners and how that one of the assumptions is that they want to learn or that it's important to them. And it seems like sometimes, of course, not with our enriched students, but sometimes students don't really, they kind of pick and choose what they think is important. And then they kind of tune out and don't engage in the things that are a part of the curriculum that we know are very important, but they just don't value or see. Do you have any ways to deal with that kind of an adult learner? Or
Well, I think that's a really good example, and it can happen at any age. It's not just the college student transition kind of thing, because, we're schooled all the way through childhood to follow the teacher, right? We want our parents to be happy, so we do our homework. We want our teachers to be happy, so we get out our books when we're told. All of that learning is very teacher driven. And so it's that maturity change that, we have to deal with. So sometimes you do need to go back to the child learner and child learning side and help them understand why it's important, not just rely on their own internal, but give them external reasons to need it. In the college setting, you very often can say, you're paying me to teach you what you need to know, right? You're paying for this. So, and you become kind of that external force then. In the clinical setting, I can tell you that usually what I've done with learners who kind of get that bit of, I don't really think I need to know this attitude, I take them down a case study line to take them over the edge of what they already know. Because a lot of times in that transition period where they're not quite mature yet, not quite mature enough yet, they kind of get an attitude of, I already know this, or this isn't that hard and I can figure it out, because they don't have a problem yet. When they're really functioning that way, we have to show them where the problem is or help them understand the need for the task. And so I very frequently will either, in a literal clinical setting, I've done it, or in a classroom setting, I've taken them down a case study road and taken them right off the edge of what they know. I just keep going with the case study until they go, I have no idea what to do next. And then they're ready to learn, because then we've given them the problem.
That's great. Including the experiential component in the case study to make it really feel real. Yeah, that's great. Thank you.
Yeah, and if you have the luxury of that, you can also toss them in a sim lab Yeah, I've had people who, really don't want to engage in learning, EKG interpretation, which is a pretty complex skill for a new nurse, with all aspects of it. And if they say, well, I had that, I had an hour of that in school, so I'm good with it. And we put them in a sim setting and they can't take it past normal. They can go normal and abnormal, but they can't go past that. So then they're ready to go sit in a class for a couple days and learn it. Okay, other questions, other ideas? Becky, from the enriched students perspective, anything that you want to add to this?
Now, I think I do see a mix of our students who are between definitely child and adult learning. And I liked what Tanya said about her conversational style. And I also liked what you said about, kind of pushing them to the edge. So Tanya and then Cheryl, I'm going to get a little more information about Cheryl here in a minute, but when you think about working with students or your peers during orientation, do you have any examples of ways that you could kind of use that thought of needing to motivate somebody to learn something that you see is really important for your clinical area, but somebody else seems to be just brushing off or saying, oh, I'll learn it later. We see that sometimes in people who are new to the setting who think they came with that knowledge already also. Do you guys have any of those situations?
I can't really think of anything specific like that. But I mean, like I said before, I do find that it's helpful when I see a certain manner of doing things to discuss it in a way that, this is my past experience, maybe try doing it this way. And also just sharing that experience as far as things that have happened in the past that maybe I didn't expect and that caught me off guard. Because I do think that's invaluable for a student, because I mean, it's really scary being a new nurse, and I know that.
Right.
So,
right.
Yeah.
One of the things, Becky, that you just mentioned, is, how to apply previous learning, and what if they don't think they need help in applying it. And I would say that the primary care setting might be a perfect example of that, because these students have had a couple, 3 clinical experiences in the hospital. Maybe they just got done with an ICU rotation or something, and now they're in an adult primary care setting, and that might feel like such a different, lower in their mind level of care, that they're kind of not really thinking that it's a hard thing to learn, not understanding that taking the skills they used in an acute care setting and applying them in an ambulatory setting like a physician's office or something is very different application, and they really have a gulf of learning. So that's really important, Becky, the way that you said that.